breaking news.
Breaking news, Governor Tate Reeves is holding his daily COVID-19 response with members of the coronavirus task force. Let's listen in.
This is and continues to be a long process. We are not going to be able to flip the light switch from off to on, just like we did not flip the light switch from on to off. Whatever we do is going to be cautious and it's going to be gradual. We have to begin reopening, but we also have to do it in a way that is safe for all. Our public health team is working on a plan to help ease us back into an open economy. I hope that we can take one step next week, just as we took one step this week. I have said it before, and I will say it again. There is no such thing as a non-essential business to the owners and the people who depend on that business to provide for their families. It is essential to provide food, supplies, and shelter for every single one of its employees, and I understand that. We cannot eliminate layoffs or economic problems. People are changing behavior on their own, and that is going to continue to make it difficult for many small businesses. We can, however, do everything in our power to limit those instances where an order from the government prevents a Mississippian from providing for themselves. I have a fundamental issue with that, and we are going to get out of that situation as quickly as we can in a safe, responsible way. Testing and tracing are continuing to come along very well. You probably remember that has been our strategy with respect to this virus from the very beginning. We called it identify and isolate. And even during these times of shelter in place, we have continued to identify and isolate. We have also continued to build capacity and increase volumes on the number of individuals at the Department of Health that are working on that project. The fact is that Mississippians are doing their part to flatten the curve, and the curve is, in fact, flattening. We see more evidence of that every day. 2 weeks ago, we had 128 patients on ventilators. Today, we have less than 80. The same trend is true for patients in the ICU. This is during the period that the national experts predicted we would be at our peak resource use. Now, those numbers are so low that they will continue to fluctuate greatly. But the good news is that they are far lower than anyone originally projected. Some national experts thought we would need about 4,000 hospital beds this week. Instead, we're using less than 400. Let that sink in. That is because your efforts are having an incredible impact. Let me say that again. What you are doing as Mississippians to protect yourselves and protect your neighbors is making a difference. In our state, we're not seeing a widespread outbreak. We're fighting smaller, localized battles. It's a different challenge. Right now, we're trying to prevent a deadly localized spread in one nursing home or one church or one workplace or one other building at a time, not to prevent our entire hospital system from being overwhelmed. Why? Because of your efforts to slow the spread. Mississippians working together are beating this virus. Now, we cannot stop it entirely without a vaccine. We can slow it down, and you have slowed it down. You've beaten every projection, and you've saved countless lives. It has taken a tremendous cost. Yesterday, I had our unemployment team here to talk about the progress that we were making. It is a historic rush on our unemployment insurance system. There are many of our fellow Mississippians that are hurting. Between the historic flooding, historic tornadoes, historic pandemic, and historic surge in unemployment, There's a greater need for help in Mississippi than at any time in modern memory. If you have any ability to support your fellow Mississippians, there is a great need. I know that it can also be hard to figure out where to give funds in a way that you can be confident it will have an impact. I want to identify one this afternoon. We've designated Mississippi's official disaster fund. It's a partnership between the Mississippi Commission for Volunteer Service and the Community Foundation for Mississippi. The team there is identifying local organizations doing boots on the ground work. They're getting food, medical supplies, soap, hand sanitizer, shelter, clothing, or a little money to people who desperately need it just to get by. The goal is to quickly flex resources to those places that need it most. By giving to this fund, Mississippians can know that the money will be pushed to the hardest hit areas quickly and efficiently. It will support local efforts on the ground. If you are interested in helping by donating, even a little bit, you can go to formississippi.org and click on the Response and Recovery Donate Now button. Again, it is formississippi.org, and please click on the Response and Recovery Donate Now button. I know there are many places you may choose to donate to help your fellow Mississippians. This is the one that we have identified as the state's official disaster fund, and we believe it can have a great impact. If you're willing and able, I'd strongly encourage you to consider making a donation today. If you choose another path, just know how much your fellow Mississippians appreciate you and your willingness to step up and help financially in these very desperate times for many of our fellow Mississippians. At this time, I'm going to turn it over to Dr. Dobbs and let him give you an update on COVID-19 in Mississippi.
Thank you, Governor. As a quick update, in our case count, we have 178 new cases today reported, with 10 additional deaths, bringing the total number of cases up to 4,894, with 193 deaths. The Governor reviewed the COVID ventilator and ICU counts. We do have on hand 666 available ventilators for utilization and 262 ICU beds. New information which you've seen on our website on long-term care outbreaks. We have 74 active outbreaks in long-term care settings with a total number of cases of 470. Of that 470, 163 are African American and 279 are Caucasian. We've had 62 deaths, unfortunately, associated with long-term care settings, 21 in African American community and 41 in Caucasians. Only other quick things just to mention, we're continuing to work our plan aggressively with our isolation and containment strategy. We're adding staff every day. We're up to about 200 right now. We'll continue to work that aggressively. We are expanding our outbreak response capabilities, and so you'll see more information on that as we work on that. Only last thing is, please don't let our guard down. We have flattened the curve, but we still have a lot of cases out there. We're going to have more deaths, and the better that we do individually and collectively, the more likely it is that we're going to get through this in a lot better shape. And then encourage, please, everyone, when you're out and about in public, if you're going shopping for food and stuff, we do encourage you to wear a mask. Thank you, sir.
Thank you, Dr. Dobbs.